All right. Dr. Amy Pearlman is back with us for procedures in men's sexual health, risks, benefits, and realities. Ooh,
All
what
right,
is
let's
that
get
all
through it.
about?
So I'm not going to go over all the procedures that we do on our male patients, but I am going to go over some of the highlights and ones that maybe our mutual patients might be asking you about. So some of the topics that I'll uncover or take a deep dive into is going to be penile girth enhancement or just penile enhancement in general, right? Oftentimes, I'm sure, I have no doubt, you can correct me if I'm wrong, Rachel, but I'm sure patients are coming in and they're asking, hey, I want a bigger penis, or are there strategies or tools that I can use to get a bigger penis? And we cannot just tell that patient, look, this is the penis that you were born with, and there's nothing that you can do. Because, folks, there are things that people can do these days that are safe and effective. So we will talk about some of those strategies. And you guys might actually have one of the most important roles when it comes to these conversations. Look, I'm all about body positivity. I wish that every person, man, woman, child, whatever, along the gender spectrum can accept and be happy with the body that they have. But the reality is, people want to enhance different aspects of their bodies. And our collective job is to figure out how we can best educate our patients so they are fully informed and can make decisions that are safe and effective for themselves. We'll also talk about some of the other hot procedures that people are talking about: Botox in the penis. We'll talk about maybe PRP injections, shockwave therapy. So these are very common procedures that urologists and other men's health providers are offering. And you all are on the front line. So we're going to take a deep dive so you know how to best counsel your patients and can maybe direct them or give them some advice. Maybe you should consider it, or honestly, maybe you shouldn't consider it, because right now we don't have a lot of research. So we're going to take a little master class in common procedures that we offer male patients.
It's awesome. And I think, again, these are things that mental health professionals don't often know and general public doesn't often know. We always, mental health professionals, we go to, well, how can people just accept what it is they have? And, working on how they feel about their bodies. But, this is important information to know, what are some of those penis growth options that people have?
Yeah, so for length, I'm not one to recommend lengthening procedures because there are some concerns, and we'll talk about what some of those concerns are. So, but there are some devices, and we'll talk about the role of vacuum pumps. We'll talk about the role of lengthening devices because there actually is some research, especially in the lengthening space, that traction therapy can be helpful for some guys. And so we'll talk about devices that actually have research to support their use and also how you can help guide patients to use them comfortably. Another topic that we'll talk about is going to be penile filler, right? You name it, someone has injected that product into the penis. So we'll talk about safer options. Right now, really the safest option we have on the market is hyaluronic acid. Hey, the same stuff that we inject in the face, we just inject it off label in the penis. And we'll talk about, we can go through some photos. We'll talk about some of the expectations that patients, can expect with that procedure and what some of those results look like.
Looking forward to it. Thanks so much. And we'll see you then.
All right, see you there.